A Medic's production.
DVLA driving restrictions for MRCP UK PACES. We will be covering the core DVLA guidelines of diabetes, ischemic heart disease, seizures, syncope, and cerebrovascular events. Before we move on to each topic, it's important to understand what each driving license means. Group 1, a private car. Group 2, bus or heavy goods vehicle. And thirdly, taxis, which have similar rules to Group 2 licenses. We'll start with diabetes. Patients with a Group 1 license must notify the DVLA if they are on insulin. Patients with a Group 2 license must notify the DVLA if they are on any medication for diabetes. Patients with a Group 1 license on insulin must renew their license every 1 to 3 years, depending on DVLA discretion. Patients with a Group 2 license on insulin or sulfonylurea or reglinide must renew their license yearly, and patients on other medications must renew their license 5-yearly. Patients with a Group 1 license should check their blood sugar within 2 hours of driving and every 2 hours of the journey. Patients with a Group 2 license should check their blood sugars within 2 hours of driving and every 2 hours of the journey. Blood sugars must be checked every day, at least twice a day, and this log is checked every 3 months by a diabetologist. How should we advise patients who have a hypoglycemic episode whilst driving? Firstly, advise the patient to pull over safely and then switch off the engine. The patient should have fast-acting carbohydrates readily available in their vehicle, which they should then take. The patient should be advised not to drive until 45 minutes after the blood sugars have returned to normal. Only then is it safe for the patient to drive. It is important to understand the definition of severe hypoglycemia, as it has significant implications in driving. It is defined as hypoglycemia that requires assistance from another person to treat. If a patient with a Group 1 license has more than one severe hypoglycemic episode whilst awake, they must inform the DVLA, at which point their license will be revoked and they can reapply after 3 months. If a patient with a Group 2 license has one severe hypoglycemic episode either whilst awake or sleeping, they must inform the DVLA, at which point their license will also be revoked and they can reapply after 12 months, providing full hypoglycemic awareness. We will now move on to ischemic heart disease. Patients with a Group 1 license do not need to inform the DVLA if they have ischemic heart disease. However, patients with a Group 2 license must inform the DVLA if they have angina, an acute coronary syndrome, or elective percutaneous intervention. Patients with a Group 1 license must not drive if they have current angina symptoms. Patients with a Group 1 license and an acute coronary syndrome must not drive for 4 weeks unless they have a successful PCI with an ejection fraction of more than 40%, then they must not drive for 1 week. Patients with a Group 2 license must not drive if they have current anginal symptoms and must be symptom-free for 6 weeks prior to driving. Patients with a Group 2 license and an acute coronary syndrome or elective PCI must not drive for 6 weeks, and prior to regaining their license need an ejection fraction of more than 40% and a negative exercise tolerance test. Our next section is seizures. Both Group 1 and Group 2 license holders must notify the DVLA if they have epilepsy, a first unprovoked seizure, a provoked seizure, or dissociative seizures. Patients with a Group 1 license must not drive for 12 months after their last seizure if they have a diagnosis of epilepsy. Patients with a first unprovoked seizure or provoked seizure must not drive for 6 months. Patients with dissociative seizures must not drive for 3 months. Patients with a Group 2 license must not drive for 10 years and be seizure-free off medication to regain their license if they have a diagnosis of epilepsy. Patients with a first unprovoked seizure must not drive for 5 years and can only regain their license subsequently if the neurologist says they have an annual risk of less than 2%. Patients with provoked seizures must not drive for 5 years, and those with dissociative seizures can drive after 3 months. We will now discuss loss of consciousness. Patients with a Group 1 license should inform the DVLA if they have an unexplained syncope or cardiovascular syncope. Patients with a Group 2 license should inform the DVLA if they have an unexplained syncope, a cardiovascular syncope, a vasovagal syncope, or syncope with known trigger. Patients with a Group 1 license must not drive for 6 months if they have had an unexplained syncope, and similarly must not drive for 6 months if they have had a cardiovascular syncope. Patients with a Group 2 license must not drive for 12 months if they have had an unexplained syncope or cardiovascular syncope. We will now talk about cerebrovascular events. Patients with a Group 1 license must inform the DVLA if they have had multiple TIAs. Patients with a Group 2 license must inform the DVLA if they have had a TIA or a stroke. Patients with a Group 1 license must not drive for 1 month if they have had a TIA or a stroke, or 3 months if they have had multiple TIAs. Patients with a Group 2 license must not drive for 1 year if they have had a TIA, multiple TIAs, or a stroke. Their license will be renewed if they have no debarring, visual impairment, or other risk factor. Don't forget to like and subscribe for more videos. And visit our website at medics.org.uk for more content.